Welcome to a Indications Conference. My name is Nick Strasser. I'm here with Jan Schakowsky. We're here live at AOFAS Annual Meeting 2023. How's it going, Jan?
It's going great, Nick. Great to see you again. It's been a couple years since we've seen each other in person.
That's right. Most of this has been done virtually, so it's fun to get to chat and talk about different things. So for those of you who have joined Indications, most of the time we've been doing case-based learning. We're going to do something different for this month's release, and this isn't live, unfortunately, but we wanted to go through the exhibitors from AOFAS and talk about the things that we saw that we thought were cool, innovative, and stuff that I think is kind of looking at things from different perspective and what we saw as being kind of hot topics. So yeah, we'll kind of dive in. We have, I think, 8 things that we called out that we thought, and that was really neat. And if we don't mention you by name, it's not that we didn't think it was great. The meeting goes by pretty quick, so it's hard to get to every booth. But we tried to make it by as many booths as possible.
And I would say, if when we post this online, if you guys have any things that we may have missed, I would welcome everybody to put it in the comments section and kind of just maybe give a little blurb of why you thought that was a pretty cool idea or neat product that you saw while you were attending the meeting.
That's right. Week. That's right. I think sometimes, it's easy as you're catching up with friends to not make it through everything. Plus the bourbon here is pretty good. So, it's easy to get distracted, I guess.
And maybe we'll have a competition at the end. It was what's the best bourbon you had in Louisville?
Oh yeah. Put it in the comments.
That might be the hottest topic.
That might be the hottest topic. Okay. So first thing I was going to mention was, the one that I saw that was really cool, was a company called Winter Innovations. Cool startup out of Knoxville, Tennessee. So, close to my stomping grounds, and their product Easy Whip, which I thought was a really cool modification of a looped suture. The thing that's so cool is it basically takes a traditional looped suture on a traditional needle, and it separates those. So you can do a closed tendon. Like in my case, I looked at that and thought that might be something helpful to use for perineal tendon, or if I'm suturing in a graft where I don't have necessarily an open end, and I can actually use that to incorporate graft into the perineal tendons. The other thing that I thought was cool about it is you can actually lock that stitch. So it allows you to, the ability to be able to lock that stitch. And that's something kind of unique to that part as well. So I don't think, Jan, you probably didn't get a chance to get by there, but, we've seen them online, and I think it was kind of cool to meet them in person.
No, absolutely. And I think, I didn't really realize there was going to be some innovation in, sutures, right? I thought we were kind of done with that,
Yep.
And I think it's been pretty cool that even looking at the website that they look to have some, some innovative ideas about some, I would say, more traditional products that we use. Yeah. So I'm looking forward to seeing what this company actually even has going on in the future.
That's right. Yep.
It's kind of it's a neat story that they have. So I kind of just I would encourage everybody to just go to their website too if they didn't see it at the AOFAS meeting this week.
All right, so we're going to move on from that and chat about some of the bracing options. And there was a lot of bracing companies here. I saw Hanger, I saw the Victory Orthotics. I thought those are always kind of cool because they have a little bit of a built-in curve with, to give a little bit of energy release. I thought that was neat. But I had a chance to chat with the group from out of Duke, that company called Protect 3D, which was pretty cool because they can do some 3D printing of their braces. And the cool thing about that is the ability to do it on your iPhone with their app. And basically, you hold the phone up to the foot or hand, wherever you're trying to brace. But in this case, it's like an ankle, and they can actually generate a 3D model of your ankle, and you can make it and turn it into like an AFO that has a little bit of energy storing. So something that I thought was really kind of cool to be able to look into.
Yeah, no, I saw that. I walked by their thing too, and I think it gives you, a little bit easier access, I think, to the custom-made bracing. You know, a lot of times people have to be casted and so forth and then get their braces made. And I thought that this was pretty, you know, a different way of looking at it to try to make it a little bit more user-friendly for some of these patients.
Well, shoot, even myself, like one of my kids needs AFOs, and I was talking to them about getting a custom AFO for him because I just don't want to take him in. It's a pain in the butt to go into the store. And so if I can just do it on my phone, send them the images, and they can just mail me an AFO, that's a win-win. And I think patients, that might be a really cool spot. Now, we didn't select them because they're Duke, but because you're, you know, Jan, if you don't know, Jan's a big Duke fan, in spite of him being in Indiana. So it's a little bit dicey. We didn't select him just for that, but kind of cool things coming out of that company. I think that's something to keep an eye on.
Yeah, I was trying to tell them that they should give a discount for anything that's in Duke blue colors. But that more to come on that. Maybe after hearing this, they might do that. So we'll see.
Yeah, we'll see. We'll see. All right. Let's talk about, I'll use the word constant compression. I think that's a hot topic. We're seeing a lot of different companies come out with different, most of them nitinol based, but kind of this idea of constant compression or continuous compression. We certainly saw that, you know, if you go by the Arthrex booth, their new nail is about set to be launched. If you went by Synthes, the acquisition of Crossroads, now they have, what did I call it? The Playple, but the staple plus the plate combo. And I know there's a lot of other companies out there. So if I leave you off, I want to be, I'm not trying to, you know, throw shade, but what's your thought on constant compression, Jan?
Yeah, it's really interesting. And I think we don't fully understand it yet. I think we like, you know, as orthopedic surgeons, we want to compress, you know, and, you know, there's a thing they say in trauma, ABC, always be compressing. And I think there's a lot to it, especially for fusions. And, you know, another company that, you know, has a lot of this nitinol and constant compression would be like AOFAS, with some of their recent acquisitions over the last couple of years. So I think there's something to it. I don't know if every patient needs it. There is an added cost to it, but for me, I think especially for revision situations or hard to fuse joints, I think there is a lot of potential for it, and kind of excited to try to use it on some of the things for some of the TTC nails that you're using, for example, for fusion purposes, as opposed to maybe not, you don't necessarily need it if you're using it in a trauma setting. So
yeah, I was thinking a little bit about the midfoot, and there was a study that came out that looked at fusion rates, and you know, CT scans look fused, but they're not. And that's maybe a whole other discussion, a whole other can of worms, but I still think we maybe don't know the full ramifications of what we're going to be seeing with some of these devices.
Yeah, I agree. I think there's a lot of potential, and we look at it as fusion, and we look at, you know, even like, you know, femoral neck screws and so forth, and other places around the body where we want to really get a compression. So I think there's going to be more studies coming out where, you know, comparing, you know, staples and nails and so forth.
All right, you're good. The other booth that swung by was Medline, and you know, you talk about compression, and they have, you know, staples and those options, but they actually have now a washer. And I believe I'm describing this right. I didn't get a chance to really look at it as much, but I've looked at it online a bit. But you know, incorporation into a screw construct, and I think that'll be kind of an interesting thing to see if that can be developed, and if that's as useful as we've seen in the staple and the TTC nails, or the, you know, the different nailing options that are out there.
Yeah, there's definitely a lot of potential, and it's just, you know, probably choosing which device for what area of the body and so forth, and you know, it's not ease of use, cost. I mean, those are all going to come into play, but I do like it. I think it's still no substitute, you know, for like good preparation of the joint and so forth. I mean, if someone can, maybe some industry, or I'd love to work on it, you know, with Nick and so forth, if how we can make sure that we've prepared the joint the right way. That's right. I mean, it's so subjective. Yeah. So we have these implants and everything that can help us maybe hold things together rigidly, but how do we know we're prepared right? Do we have enough blood supply? Do we have the right, you know, local environment that we've created for fusion? Yeah,
you can't substitute for sloppy surgery when it comes to like joint prep and reductions, etc. So weight-bearing CT scanners. Jan,
Yeah.
do you have a weight-bearing CT scanner?
We do.
You do?
Yes.
Do you use it?
So sometimes it's a little bit harder to schedule at our institution. So sometimes we opt for just the, if I don't clearly specify weight bearing, many times my team will get just a regular CT. But I find it helpful, especially when for certain injuries, like for example Liz Franks, because I can see both sides right away.
Yeah.
I can compare both feet, but I think there's and it shows me more of the dynamic deformity if patients are complaining of something. Yeah, I wish I actually just used it more. I know some institutions where I did my foot and ankle training at Camel Clinic, they would get it almost routinely for patients. It was like the default was weight bearing CT.
Yeah.
And now it's like really for us, it's a change in culture. Like, hey, we have a weight bearing CT to get it.
Yeah, it's changing those.
How about yourself? Do you use it in practice?
No, we don't have one. I'd love to be able to use it, for my flat foots, at least kind of, we did a lot of interviews with some of the paper award winners, and a lot of them incorporated weight-bearing CT scanners into their assessment of progressive collapsing foot deformity.
Right.
And it kind of, like you said, part of the routine workup of those patients. And I think as long as you can kind of figure out what the clinical implications are and if that affects your surgical decision making, I think it could provide a lot of value.
Yeah.
We ran across, there's a company called Simulate, which is basically a device made to be added on to a regular CT scanner and can load the joint and simulate a weight-bearing CT. And I thought that was really interesting because some of these companies or some of these like practices can't have enough production through a regular weight-bearing CT scanner. And so in terms of like looking at alternative options that may be more tenable to your institution, that may be a nice option for you. So I think it's worth looking at, called Simulate, and it kind of simulates a weight-bearing CT scan on a regular CT.
Absolutely. I mean, if for us, we have one weight-bearing CT scanner on just at our main campus, but I mean, we have other multiple hospitals and campuses. So then the patients have to go to that place, which is another barrier.
Yes.
So this would limit the barrier for patients getting a simulated weight-bearing CT. I thought that was kind of ingenious when I saw it. I was like, oh, why didn't we think of that?
Yeah. And I think the cool thing would be is if they could do that with MRIs.
Oh, absolutely. Oh, yeah.
If that could be adopted into that realm, that would be a really cool thing. Because I think that could be really helpful for a lot of decision making.
Absolutely. And you mentioned like some of the paper award winners, and I know one of them and some other people that you might have interviewed, like Dr. Lyndon Mason. So he was telling me that in their practice right now for like Liz Franks and or suspected foot injuries, they're getting weight-bearing CTs because they said it's actually faster for them and cheaper than getting comparative foot x-rays for the patient. They said it takes them like, I forgot how many minutes he said for a weight-bearing CT. He said it was like 5 minutes in his institution versus if they were to get bilateral foot and ankle films, it would take about 45 minutes to get perfect images for a series of left and the right.
I think that's really insightful. Yeah.
I mean, that's just think about the time saver, and you get all the information at once as opposed to, hey, go send the patient back for another x-ray or and so forth, which we many times maybe, we do. And that just, obviously bogs down clinic and, patient frustration. And so forth.
I mean, it's supposed to be pretty quick. There was a company called Curonix, and I bring it up. I tried to swing by. I didn't get a chance to, but they have some peripheral nerve stimulators. Are you doing anything with that, Jan?
I am not. We have some of our non-op physicians who are doing a lot of nerve stimulators and trials with it. I not yet. I think there's, for me, I really, I've looked it up, I've researched it. I've seen really just, somewhat mixed results. And I don't know if it's just because these are many times complex patients that they're being prescribed. But I think it's a potential, it seems like a potential treatment for many patients as an alternative to opioids and so forth. So, I mean, and many people after, foot and ankle injuries, crush injuries, trauma, they get this chronic pain that, you look at the x-rays and you're like, the x-rays look okay. And they're suffering, right? I mean, they're not making it up, and it's very difficult to treat.
Very, very, especially like you said, the crush the crush injuries and such. And so I think, you know, anything that can continue to kind of move that area forward, they're just our options are so limited when it comes to managing them. I'll send them to some of my hand partner does a lot of peripheral nerve releases and is actually quite helpful in that regard. And, you know, he also does all the for the BKs, the targeted muscle reinnervation. And so it's really helpful to have, you know, that sounding board to be able to send patients to. So
yeah, I know it's off topic, but are you doing a lot of targeted muscle reinnervation for any of your?
I try to do it. I try to send pretty much any young patient that's getting a BKA. I just send them to him, and he just schedules it for a couple of weeks after their index procedure, and brings it back and does it as an outpatient. And they've been pretty good success with it. So, you know, we've mentioned companies like Cerament before, you know, an injectable bone graft substitute. And, you know, the thing that I thought was kind of cool is they came out with something called the Flomax Toucan, which now couples with their injection. So if you're doing a long bone intramedullary nailing and you want to use it for osteo, it's made of PEEK, I believe. And if I'm saying this incorrectly, I can adjust it in the comments, but it's made of PEEK, and it can, you know, give you a little bit more access to it, and you can see it under fluoro. So kind of targeting where you're delivering it. So having a longer delivery system, I thought was kind of cool.
Yeah, I'm really, you know, I've used Cerament before, as well as some of the competitors too. You know, I think targeted delivery of antibiotics in some type of carrier that degrades over time is, like, I think we're going to be using that more and more.
Yeah.
I mean, we use antibiotic powder and, you know, vancomycin, tobramycin, and there's multiple studies that show that works. And so I think, you know, but it's very short lived, right? That powder is there. It's like, you know, magic dust, and then it goes away. And I think this is more, you know, I think especially in the trauma situation, or for, you know, history of infection or treating current infection. I think there's a lot of, you know, I have a lot of hope for this in the future. So we can, you know, just basically targeted delivery instead of someone getting a PICC line for 6 weeks. Maybe we only do, you know, 1 or 2 weeks of IV antibiotics, and then we treat them locally with this. I think that can really help a patient out quite a bit.
Yeah. 3D printing, hot topic. Are you doing any sort of 3D printing? There's a number of companies here. There was Synaptic, which I think was ceramic. There is obviously have a Restore 3D, 4Web, and then the other one that was OPM, which is like a PEEK, is my understanding. Are you doing any work with 3D printing at all, Jan?
I have not. I'm interested in it, and I think there's, like, once again, there's a lot of potential for it, you know, especially for the right patient.
Well, and I should clarify, you know, 3D printing and custom implants.
Yes, yeah, for the custom implants, I think there are for the right patient, I think that can be a game changer. I have not used it, but I've seen some, you know, case series and studies that people have published, whether online or, you know, in a journal and in some of our journals, and I think it's a great option. I think we're still learning about it. I think it doesn't, you know, just because you have a 3D printed implant doesn't mean, like, okay, problem solved. But I think it gives us another tool in our toolbox.
Yeah, well, especially for those cases, you know, I think the one that we talk a lot about is like the total talus, right? You know, where you have like no other option, and you're looking at either a amputation or a very complex fusion with bone loss and multiple surgeries. I certainly think it makes a lot of sense. And I think I don't know if it works like this for you, but where I'll run into problems is getting approval, hospital approval. And so justifying why you're looking to do that as an option, I think it can take a little bit of work on the front end.
No, absolutely. And I think that's why, you know, I've referred a couple of them out. I've not done them myself, just because I guess just, you know, in my practice, it was few and far between to see those patients that would actually qualify for it. But I do think, you know, especially that we have limited options for like tailor reconstruction after trauma or after AVN. And so I think, you know, what are the options? Below knee amputation, right? It would be aggressive. A fusion, complete hind foot fusion for a young active person is not a great option.
And you have to build it up with bone, probably.
Absolutely. And so that's not even easy just because you say fusion.
Yeah.
I mean, you have to find bone. It actually has to heal.
Yeah.
So I think this is, I think we're still learning maybe how to do it better in terms of what patients to select.
Yep.
Yeah, and that's just in the talus, but I mean, I've seen it in 3D implants now for other areas in the foot, and we're seeing it in other areas of the body as well. But
and I think, if you run into this, I guess maybe this is more for thinking through the approval process, and I still think we're figuring that part out, but perhaps partnering with people in tumor or total joints that are looking at some of these complex reconstructions can be a unique strategy.
Yeah, I know one of my partners who does, one of my tumor partners, he's used this now several times for big tumor reconstructions.
Yep.
And has had success. And I think, so I think there's a lot of, they have experience with it. I think a little bit more than we're catching up to that.
And I'm not aware of all the companies that offer it. But I know even, companies like Stryker now has an option. I think they're coupled with 4Web, and I think Paragon has an option for a total talus.
Yeah, they do. Yeah, I know they're going for, I think, full approval now, full FDA approval. So it's not just the compassionate use.
Okay, awesome. And then the tumor one is Oncos, I think is the right name. And that's what some of my partners will use. So there's some different options out there that you can kind of look around and see. Total ankle, final one, total ankle. Lots going on in the total ankle world. I guess I didn't see anything super new. There's always, new systems that seem to be coming onto the market. I know companies like Restore 3D now has Kinos. Paragon has Apex, that's right.
It's called Apex.
Exactech has Vantage, and obviously Stryker has Infinity, InBone, and stuff. But patient-specific guide seems to be the way that I think total ankle continues to move forward. It's definitely been a game changer. What's new in that world? Some of the things that I saw were the ability to look at and adjust your plan based off of 3D modeling, which maybe frightens me a little bit, right? I don't know how you feel about that, Jan, because I don't want to mess something up, but I think that has kind of an interesting application here in the future.
Yeah, definitely. I think I think if you don't have patient-specific instrumentation and cutting guides, I don't know who does it now.
Yeah,
I think it's a must. I'm curious of how that will, even progress in the future about, in terms of potentially revision total ankles and so forth. How we're going to do that patient-specific wise too. I'm also waiting for the first company to use robotics to do a total ankle, and it's probably. We don't have the volume of total ankles yet, obviously like hips and knees, and we probably will never. But that's something I'm looking forward to too, just to see if that maybe helps us recreate some of these things. So maybe patient specific, it won't be as necessary, because I wonder if that's why we're using it more, because we don't have a robot assisting us sometimes. But who knows?
Yeah. I think that definitely has a very, it'll be fun to see what comes out of that. So
when's the last time you did a non-patient specific total ankle?
2 years. 2 years ago.
I've never done one.
Never?
No, I did one in training. Never mind, one in training, because I said that, and I remember Drew Murphy, who I worked with, was like, well, look, we're going to use the frame. And he used the frame, he loved using the frame from Infinite, from
InBone.
Right. Yeah, exactly. He loved it. And I think when I look at that frame, I get I don't know, I get anxiety.
I was fortunate to kind of come through the tail end of the frame and training, and meaning that kind of before patient-specific guides became so popular. And I will tell you, it has been quite valuable to have that understanding, because some of those cases with deformity, the frame can actually help you get the
Truly.
correction. And so, yeah, is it futzy? It can be. I think the part that now I get a little nervous on is if I have to judge rotation from it, because that can be hard to tell with like post-traumatic deformity. Is your mortise true? So where is that rotation? So I've definitely had cases where I probably would prefer to have a little different rotation of the implant. But when it comes to correcting, particularly the coronal plane deformity, it's really powerful. So if you ever have a case where you're like, it's a lot of deformity and you really want to crank it over, once you get that intramedullary guide into the talus, now, and you've done all your releases, now you can use the frame to help guide your correction before you run that reamer up the middle.
You know, it's interesting you say that, because, I think now I know many fellows who are getting, doing total ankles during their fellowship year have not seen the frame.
Never done one
at all. And not all companies obviously have it, right? I mean,
right.
I have no stock in them or anything, but I don't think right now, Stryker, I think they're the only company that has it, right?
Well, I think they all have.
They have
extramedullary, but
they have a frame.
Not a frame. No,
not a frame like that.
Not that I'm aware of. Yeah. So
Yeah.
it's interesting. And I think your point's well made that, and I don't know I don't know if I'd be brazen enough to suggest you should just do frames because to get the experience, but you also don't want it to be the first time you use it to be in the midst of a complex case. And so I'm definitely very appreciative of the time I spent with Hodges and Bob and doing these cases where we were using the frame to do the correction. And that has been valuable, because I think even though it'd be a little bit of a learning curve to go back and do it again, at least I feel comfortable with the steps.
Absolutely. No, I mean, and that's why you can take advantage of like labs and so forth. And,
that's a good point.
And so forth. And because I know, like, because now that you said, I remember I saw with the Apex ankle from Paragon, I did see like an extramedullary guide. So they do have it. They do have to have it, but I just don't know if they have it if it's as powerful as a frame.
For that stem component. Well, that was a good rundown of things we saw. If you feel like you got left out, put it in the comments below. We certainly didn't mean to leave anybody out. It's been a whirlwind of a couple days, so we want to make sure we at least covered a few of the things that we saw. And it was a great meeting. I thought it was really cool having these mobile labs in the exhibit hall. That was really cool. It's fun to meet you all. We really appreciate that, reaching out to us, networking, and appreciate your support, and continue to sign up. Tell your friends about our indications webinar, and we'll probably get things started up again in October with a live show.
Yeah, and absolutely. And don't forget to, in the comments, if you have nothing to add in terms of some device, please tell us once again what your favorite bourbon was and where you got it. So safe travels, everybody.
Take care.